We are going to contest that immediately. We think the state of Florida has standing to do it, and we also know businesses that we're going to work with to contest it. It's interesting with OSHA, and I didn't realize this until this became an issue, you actually can go straight to the Federal Court of Appeals. That's the way they do it. So you'll see cases in the 11th Circuit here in the Southeast. I reckon Texas will go into the 5th Circuit, and I think that the mandate is going to lose in court. I also think that we have a responsibility at the state level to do whatever we need to do legislatively to be able to protect Floridians from mandates that could result in them losing their jobs. We have to protect the jobs of Floridians. We helped out the folks in Gainesville. They were going to fire some of the police officers, some of the utility workers, some of these people who had been on the front lines of helping our communities for the last year and a half doing their job. Then all of a sudden, you're going to tell them that they lose their job unless they too take a shot, which again, most of these people have had COVID and they have the right to make those decisions for themselves. So I just think it's fundamentally wrong to be taking people's jobs away, particularly given the situations that we see ourselves facing with the economy, where you need people in a lot of these key areas. What's going to happen with these hospitals if these mandates are allowed to go in where they already need more nurses? So what, you're going to end up doing this? And if even a small fraction of those nurses decide to go somewhere else or to leave, man, you're going to have huge problems. Now, fortunately, our hospitalizations have been going down so dramatically that we're in good shape. But these others, the northern states, they're all rising, and they're likely to face similar wave that we saw this summer. So that's just the reality. It's not good policy. It's not good policy to destroy someone's livelihood, to take their job away. It's also not good policy to unilaterally impose a mandate that you don't have authority to impose. The OSHA does not have this authority. There's no statutory basis for it. This is a total reach that they're doing. It's also, of course, bad for the economy when you could potentially cause people to fall out of the workforce as a result of this. So let's protect people's jobs, let's protect their ability to make their own decisions, and let's not have Biden come in and effectively threaten to take away the jobs of people who have been working hard throughout this entire pandemic. I am offended that like a police officer could potentially lose their job. They were not given the ability to work from home. They didn't get to Zoom in to protect us. It ain't gonna work to protect the public on Zoom. You gotta be out on there. They were there the entire time. The firefighters were out there the entire time. And if someone had COVID, they'd have to go and expose themselves. For months and months and months this has been going on. And again, most of these people have already gone through it and have natural protection. So let's just be real here. And I think it's a huge overreach. So 100% in court. I also think legislatively protections for people so that they can't get fired, but also protections for them. I mean, if a business forces somebody to do this, then that employee, if there's anything that happens negative as a result of that coercion, they should be able to go in and then sue and get compensation and get damages for that. I also think we worked very hard in Florida to provide protections against COVID liability for businesses because we worried about people just going in and starting to sue to say, hey, I was in your business and I caught COVID, therefore it's your fault, that's just not the way respiratory viruses work. We've never done it that way. So we provided good protection, but if businesses turn around and now they're imposing mandates, then that protection to me is something that we would probably want to peel back from those businesses. So we're thinking through a lot of different things. I'm going to definitely want to see action on it legislatively, and then of course we are going to see action in the courts. I do think Biden's employer mandate, the mandate on private businesses, will go down. I also think the mandate on any hospital receiving Medicare or Medicaid funds, I think that it runs afoul of the law. That needs to be challenged. And then you have this one with the federal contractors. They're rewriting federal contracts to say anybody who's providing services to federal government must force this on everybody in their organization. Again, don't have the authority to do it. and not really a smart thing to do in terms of making sure we have the folks in place to keep our economy going, particularly in times when you see rampant inflation. You have all these supply chains disruptions, and a lot of that, again, is born out of bad federal policy.
And if I could follow up on that with the Surgeon General, we already heard you say you do not believe in mandates. The governor talked about policy and politics. Can you explain scientifically why?
So, yeah, thanks for that question. So, you know, it's interesting. I mean, the answer is that mandates are not a scientific question, really. They're a philosophical question. So, you know, the piece that I would say that is scientific is that when you make it hard for people to avoid something, then they tend not to, you know, they tend not to avoid it. So, yes, you exert pressure and people change behavior. You know, that's true for many different things. But mandates are really they're about autonomy. They're about who controls whose life, you know. They're about whether kids belong to the parents or whether they're instruments of the state in terms of some of these mandates related to masks. So it's a philosophical question. And my own personal belief is that it's absolutely completely wrong to be forcing measures that are related to people's bodies, their personal decisions, you know, just because you want to achieve some outcome. I think that's completely wrong, and you know, I have no doubt in my mind that that's completely wrong.
And I would just say, I mean, in terms of the science, and I don't want to speak for the doc, but I think he'd agree with me on this. These vaccines have provided benefit to individuals to reduce severity of illness, less likely to hospitalize, less likely to die. I think the data is very clear on that. However, the vaccines are not providing the type of public benefit in terms of stopping transmission that we had hoped. Not saying that it provides zero protection, but I think if you look at the cases that we've seen throughout the United States, year over year, we're much higher this year as a country than we were last year. I think every state over the summer had higher cases than they did year over year. And so, and of course we know, breakthrough cases, it's a misnomer. It's not rare. It's something that has happened. You've had groups of vaccinated people. A bunch of them test positive. So that's fine. Doesn't mean there's not value in it, but forcing this in like a workplace, it doesn't mean that you're still not going to see infections. I think there'll be mild infections, hopefully, and if they're not, we have monoclonal antibodies where you can come and hopefully nip it in the butt then. But that's just the whole idea of vaccine passports was that you would be able to force people to show this and therefore guarantee a COVID-free environment. We've seen these cruise ships will go, they're all vaccinated, and you have outbreaks. And again, it doesn't mean there's not value and benefit in having protection against severe illness. But let's just be clear, it's not 95% reduction in infections, which is what the clinical data for Pfizer and Moderna said. Israel looked at it and they said it's probably 35 to 45% in terms of the reduction, which is pretty low, quite frankly, for this. So that's just the reality of it. And so we have to look at that and face facts. And so to force somebody else to do, and especially, again, scientifically, people that recover from COVID have protection through the immunity that develops through fighting off the infection. That's clear. I don't think anybody that has any credibility whatsoever would honestly say that you don't have protection, and it's proven to be pretty strong and pretty durable protection. Israel did a study, and very thorough study, and they found that your chances of being infected were reduced dramatically compared even to the vaccination in terms of having the natural immunity. So these people, a lot of these folks who are in a position where they don't want to submit, don't want to be coerced, they actually have natural immunity. Many of the frontline workers have had this over the past year and a half. And so scientifically, why would you mandate somebody that already has a pretty darn good degree of protection? And I think what the doctor said is it's more about they're trying to exercise control over people. and they are trying to create two classes of citizens. I think some of it is politics. I think they think that the people that don't want to be vaccinated are their political opponents. That's not really true in Florida. If you look, you can look demographically and everything about how that breaks down. It's not so neat and tidy as they would like to say, but I do think that there's a lot of motivation about that. And so from an epidemiological perspective, to marginalize people who actually have better immunity in many respects than people that would somehow have a ticket to ride in society, that doesn't work. And of course, in Florida, it shall not stand. That's why we worked very early to make sure that we wouldn't have this type of discrimination in our basically public accommodations. And if you want to go to a restaurant, you want to go to a movie, you want to go to do those things, you have the right to do that as a free citizen of this state and of this country. So, but it's interesting. It's taken them a long time to do this rule. I thought it would, if it's an emergency, you think that they would crank it out, maybe work 24/7 to try to get it out. We're now, 35 days after they made the initial announcement. I know it's at Office of Management and Budget, but you still haven't seen the actual text of the rule, and I'm wondering if it's such an emergency, why couldn't they have cranked that out earlier? And so it's going to end up going through that process. And when it first came out, I mean, we assumed we would get it much earlier than this, and we were kind of wanting to see the language. We still want to see it, but we've also had to make preparations to say we've got to move forward here. So there's going to be ultimately you're going to see. Does the federal government have this authority? Clearly, Congress has never enacted a statute to this effect, so this is unilateral executive action. Does that trump the ability of individuals to make their own choices or the ability of states to be able to provide protections for people and for their jobs? I know where I stand. I want to protect people's jobs. I want to protect people's livelihoods. I do not want to see people cast aside based off some overbroad, very harsh mandate. And so let's be there for our fellow folks. Let's make sure that they keep their jobs, and we're going to be fighting for that very, very hard as this continues to unfold. Okay, thanks everybody.